What is a platform? Well, a platform is the base on which an intervention and a service process of screening or treatment is defined and delivered. It needs to have and needs to be able to do a number of things. It needs to be configurable so it can support and facilitate treatments that may follow a common general protocol and general process, but may need to be adjusted in terms of timing, order, and various options. It needs to be configurable so that you can do that quickly and effectively. It needs to support obviously nowadays, multimedia and support multi-language. For instance, I worked in Hamburg for a number of years, and it was amazing in Hamburg that the mix of population that spoke many different languages. So you could have a situation, it's the same one we have in the UK, where there could be a treatment for depression or anxiety, but dependent on the needs of the individual in that community who logs on, it's able to serve video in different languages, audio in different languages, have documentation in different languages. And it also needs to support, all platforms need to support the ability to deal with multiple modalities of support. So if one clinic may work primarily on telephone support, another may work on face-to-face support, another may work exclusively on facilitated forums or an email. It needs to be able to support all those different modes. It needs to be able to pull the data together and the evidence together to enable all of that information, everything that's done, everything that's delivered, when it's done, how it's done, and where it's done, to be pulled together and auditable. Because of today's regulation on patient record compliance and security, it needs to be HIPAA for North America and ISO compliant for Europe and many other territories. It also needs to support the different instruments. There are various instruments used in various territories that are different to those in others. And for instance, the UK has a national minimum data set, which is very comprehensive, and it may be deemed in other territories that to use all the instruments every time a session's used and a session is done isn't necessarily appropriate or suitable for the profile of the service users and the patients. So it needs to be able to support configurable standards. And really it needs to, and increasingly will need to support delivery using different methods and to different technologies. So the multi-platform aspects of being able to be accessible from both PCs, mobile phones, and for instance IP and 3D TVs is going to be of increasing importance. Something that there's more and more evidence on and an increasing research base on is the use of things like email, and in particular now with mobile phones, SMS to do patient support, and as well as doing data collection for the purpose of instruments and measuring outcomes. These all need to be supported on the platform, as does the ability to take a treatment that's developed in one place, put different wrappers around it and make it look different. So for instance, a treatment developed in a territory such as North America or Spain or Mexico or Germany can be adapted and have a different look and feel depending on the client and the specific customer that's using it. So the same treatment can be badged and repackaged for different healthcare providers and different service providers. In terms of informatics and research, there's a number of things that are very fundamental. What data is collected? Well, as much data as you require. The personal data of the patient, the treatment interaction information as to when they've logged on, how long they logged on for, what time of day it was, where they geographically were when they did it, understanding the scores and ratings of how they've progressed through the treatment, understanding the details of their national health number or their personal security number or their insurance claim details can all be captured on the platform and transaction reports produced. What can you do with all this information? Well, you can monitor progress of it. You can use the platform to provide governance and watch not only what's going on and the behaviour of individual patients, but also you can start to benchmark which of your clinicians and support workers are treating people most effectively, how regularly they're doing it, and not only compare the performance of the individuals delivering the treatments, but actually benchmark one form of treatment against another, potentially in the same area or even across geographies, or in the case of employee assistance programs, across your global network of customers. All this data can be cut in different forms and delivered and developed in reports. The data can also be passed electronically to electronic patient record systems or other systems, of course all compliant within HIPAA and ISO and patient and local government regulatory frameworks for the interchange of data.